from Sanctuary Functional Medicine, where we help patients live healthier, more abundant lives, and we help you understand your health better by doing these Facebook Live educational sessions. So today we will be talking about Lyme disease, what it is, why conventional medicine doesn't recognize it, how to test, and how to treat. If you can hear me, please do click on and give me a little thumbs up or volume good kind of report, so that way I know that I'm coming through loud and clear. Give everyone a few minutes to get online, and then we are going to spend about the next 55 minutes talking about Lyme disease. Hey, we've already had a good bit of interest. We have a few questions, but you will also have an opportunity to ask more questions. First, though, I'm going to start with about anywhere from 10 to 20 minutes of an introduction to get us all up to speed. It may answer a number of those questions, but we're going to talk about what Lyme disease is. So first of all, Lyme disease is by a bacteria, a spirochete, which is a type of bacteria. Think of a corkscrew, a little spiral that is carried by ticks and gets into our body. It is, again, a bacteria, so it can live in different places, but it uses our bodies and the bodies of mice, the bodies of other animals like deer to live in and to get transported, and particularly the ticks who pass it from one of those hosts to the next. So this bacteria, what can it do to you? For those of you who have had Lyme disease, either an acute form or a chronic form, are already all too aware of what that can do. In acute form, it can cause a fever. Some people call it the summer flu. You feel achy, you feel like you've got a flu bug, get a little bit of a fever, a little vague rash. Most people know the fact it can cause that target rash, the bullseye rash, where it's a good size, red, and it'll have some red, white, 2, 3, 4 rings worth around the area where the tick bit in the first place. Now, with that, acute Lyme can go away. Some people's immune system's strong enough to fight it off. But if you have chronic Lyme, in which it doesn't ever go away, or it goes away and then comes back when your immune system is weaker, in those cases, it's because it went into dormancy. Even though you fought it off seemingly the first time, it's hiding out in different body tissues and then able to come back and wake up again and start growing. In those cases, the initial, you can have the flu again, you can have even carditis, meaning inflammation of the heart, chest pains, arrhythmias. It can cause Lyme arthritis, meaning it can cause joint pains. It can cause Lyme meningitis or encephalitis, where it's affecting around the brain or within the brain, and the resulting symptoms. In the case of the chronic Lyme, a lot of those same acute symptoms can continue in different forms, but it can also cause just a chronic fatigue, a chronic achiness. A lot of times those joint issues go from being just one joint to your elbow for a few days, and then your knees for a few days, and then different knee for a few days, and then your back. So it will migrate or be migratory polyarthritis, not necessarily more than 1 or 2 joints at a time, but it can vary, which gets people a little confused. Which joint is it? Why are you aching and not able to really put their finger on it? It can cause skin rashes. So usually not those bullseye rashes coming back, but more rashes that are random, that people wouldn't really know to connect it with. It can cause neurologic symptoms. So in kids, it can cause PANS or PANDAS, pediatric autoimmune neuropsychiatric syndrome, or PANDAS is when that's associated with strep, but in this case, PANS could be from Lyme, a number of other causes, other infections, toxins, but children just suddenly have a change in personality. They may get borderline personality symptoms. They may get obsessive compulsive symptoms, acutely anxious, panic attacks, acutely depressed, just kind of waking up one day being abnormal, although in Lyme can sneak up a little bit more slowly than, say, with strep is usually an overnight thing. Causing ongoing symptoms, it can cause a lot of neurologic symptoms in adults and kids, tingling, ear ringing. It can cause a form of Bell's palsy in which part of the face is paralyzed. and you have trouble smiling, one side goes up and the other side doesn't. Neurologic symptoms of even paresis or weakness, or numbness and tingling in arms, legs, mimicking other diseases, other neuropathies, diseases, inflammations of the nerves. With that, it can also cause a lot of other internal symptoms besides the joints, the skin, the neurologic, emotional. We talked about with the neurologic. It can affect the gut, can contribute to dysbiosis, can cause ongoing blood pressure issues because it's affecting the heart, causing some dysautonomia, meaning your heart, your blood pressure, your heart rate can fluctuate based on standing or sitting and be abnormal. And then what we deal with a lot at Sanctuary is the chronic inflammatory response syndrome, similar to mold. And if you look at our mold website that we just put up in the last few weeks, talking about all the symptoms that mold can cause with the chronic inflammatory response syndrome, pretty much most of those things are the same for Lyme when it's chronic. The one difference that many of us who take care of these type of patients will say, mold is a little more consistent, doesn't vary as much, whereas Lyme can be very fluctuating, and that's part of the life cycle. The Lyme can be growing, taking a break, growing, and you will have more symptoms during that growth phase. So if you look again at the mold website, it gives you a list of all the different symptoms for mold, and those cross over for Lyme. How do you get it? Most of you know you can get it from ticks, so certain species of ticks, not everyone, but it's a lot of those smaller ones that are harder to see, but those ticks carry that inside their saliva glands in their gut, and when they bite you, they're spitting into your skin so they can dissolve and prevent from clotting your blood so they can suck blood out. So when they do that, the little bacteria get squirted in and they get into your bloodstream and start causing inflammation. Now, we're all aware of that, but 50% of people that have Lyme didn't know they ever had a tick bite. And in Tennessee, there's a lot of those. So with that, there's also good reason to believe that other biting insects, potentially mosquitoes, potentially other biting bugs that could carry those. There's research ongoing about that because there's a lot of question like, well, how did you get that Lyme if you didn't have a tick bite? So definitely through other insects. They're also, given that Lyme, being a spirochete, is a cousin of syphilis, which can be transmitted either through mom to the fetus, the baby inside, or during birth, and also through sexual contact. So there is definitely reason to believe that mom can pass that on to others, or that can pass between two people during intercourse. So with that, there's a lot of different ways that you can get it. There's a lot of different symptoms that you can have from that. And it is simply a disease, both an acute, a short, early form soon after the tick bite, and a chronic form that can persist or return even years later, like many other chronic diseases. That affects a huge number of people, estimated over 300,000 a year in the United States, and those numbers are growing when the CDC actually has to admit that it's a bigger problem. And if you look at the map and look at the years, how many cases have been reported across the United States, the map is filling. More ticks are carrying that, more of the bacteria are spreading, and especially as we have more travel in international and even domestic, they're carrying that around to different places. So that's a real basic start on it. So then people are like, well, it sounds very simple. Why is it that conventional medicine really denies the extent, or really especially the existence of chronic Lyme, but the extent of the Lyme problem? Well, it comes down to a few things. Part of that is in the way we test. Part of that is in the fact that our paradigm in medicine, what we're taught, doesn't allow for the process of thinking through chronic diseases. For example, we are taught Koch's postulate, K-O-C-H, basically this famous microbiologist who said to determine that a bacteria or some microbe is causing a disease, you have to actually get it out of the person or animal that has it, culture it, identify it, put it back into another separate animal that's been uninfected, and see the same disease. Now, you're kind of assuming that that's 100% all along the way. The problem with Lyme is the fact that not everybody that gets Lyme gets a disease. 2, not everybody that gets a Lyme disease actually has the same disease. So sometimes it's neurologic, sometimes it's more joints, sometimes it's skin, sometimes it's short, sometimes it's long. So there's not a good consistency so that they can do those tests. And the other aspect is Lyme is very slow growing. It is not like a pneumococcus that you get a pneumonia from, but it is something that grows slowly, days and weeks at a time. So it's harder to culture. It's also harder to identify because it changes its disguise, and we'll talk about that in a minute more with testing, but it's hard to really pin down, okay, this person who has this disease complex or this set of symptoms has this particular microbe, bacteria, Lyme in this case, that then when you take it out, you grow it and put it in someone else, which who wants to be infected with that Lyme to test it, that it proves that that is the problem. That is an issue, and we've got to get past that expectation for a disease to be caused by a specific organism. And especially this organism can trigger a lot of inflammation, a lot of downstream effects. So you may have a tiny bit of the organism in your body causing a huge amount of effect. So it's harder to prove, oh, we get a tissue diagnosis, diagnose a ligament and find, oh, there's Lyme there. But what if the symptom is actually neurologic? So how can we prove that that was connected? You've got to think outside the old-fashioned box of Koch's hypotheses. So with that, we also are looking at a bacteria that changes its disguise a lot. So it has multiple different proteins on the surface. And based on how your immune system's reacting, it will pull some out and put others out. So it changes its disguise like a chameleon. It also changes shape from spirochetes to cyst forms to round bodies to different forms that can hide easier and our body can't respond to as well. So it is a very difficult bacteria to prove from standard procedures and standard processes that it is connected to that disease. So then let's talk a little bit about testing. So we talked about how hard that is and makes it where conventional medicine wants to deny that there is such a thing as post-Lyme syndrome, despite the fact, let me say this, there are studies in animals when they have infected animals, monkeys or macaques, I can't remember which one it was, gave them Lyme, let them have that for 2-3 weeks, gave them a few weeks of antibiotics, waited a few weeks and retested those monkeys, and they could still find living Lyme bacteria in that after, I think it was 4 weeks of what they would consider appropriate antibiotic coverage. So we know it does persist, and that's been repeated in a few other animal studies as well. So why is testing so hard? I mentioned the fact that it's changing its disguise. So if you look at the traditional Western blot, it has a bunch of different bands. Each of those bands are looking at different proteins on the surface. So in one person or one animal, whatever it may be, you may have 1 or 2 or 3 bands, and another can be different bands. So not everybody's going to have the same set of bands. And early on, you may only have 1, 2, or 3 and not meet the CDC criteria of needing 5 bands of IgG or 2 bands of IgM, and may fail even though you have Lyme and you are borderline on their testing. The other issue is the standard tests that you will get from your regular labs are only going to have 1 strain of Lyme that was isolated from 1 tick years ago, and antibodies were developed to test for that one. It doesn't. That's American Lyme. Doesn't include Asian, European. Doesn't include cousins of Lyme like tick-borne relapsing fevers, which are also Borrelia, the genus of Lyme, Borrelia burgdorferi. There's also Hermsii and Miyamotoi, other ones. With that, if you're testing and you have, say, European Lyme, it may not show up with the American Lyme test. It might, but it might not. Also, the current Western blot test, when they often use a single antibody first, which may miss a number, and we don't know that they actually do have Lyme. Even when you do the Western blot, which is how I start, they don't include one of the bands P34, which is important. They took it out years ago because there was a Lyme vaccine to be attempted, ended up flopping. People had too many reactions to it, but they used that protein on the Lyme surface, so they didn't want to test a protein that they were making a vaccine to. But they never put it in after the vaccine did not end up doing very well. So we're not testing all Lyme. We're testing using wrong tests. We're leaving out a 34 band. When someone asks, how do you test for Lyme? Well, I use a lot of different tools. You're going to hear all kinds of different things, from nanotraps to different lab companies named without getting into everyone, different types of spots and so forth. None of them are perfect. All of them have limitations. Yes, if you do a biopsy of tissue and find Lyme, great, but you could have Lyme in your body, do 20 biopsies and not see it because you're not looking in the right piece of tissue, or you missed it by that much. So with that, we are going to use a number of tools to look at that because sometimes the first tool doesn't work, so we keep advancing until we use ones including PCR, advanced Western blots, looking at the other tick-borne species to try to find that. Now, we also use some reactions such as CD57, C4a, TGF-beta to look for reactions to a biotoxin, which Lyme also makes a toxin. I had not mentioned that earlier, but part of the reason we get sick is not just from the Lyme itself as an infection, toxin it makes, and even some of the inflammation it leaves over when it's dead. The leftover dead bacteria can even trigger ongoing inflammation in some studies. I think it was Johns Hopkins University that reported on that. So then, let's say we do diagnose somebody with Lyme. We use history and physical to suspect it. We diagnose with appropriate test by appropriate criteria and not just the CDC's version. It's a little too high of a bar to prove. How do we treat? That's the other issue. Oh, standard medicine wants to just do an antibiotic, do it for 1 week, 2 weeks, maybe 3 weeks, unless they will diagnose if you have Lyme in your heart, meningitis, or joints. Initially, they'll do it for several weeks, but still, even then, it may be 1, maybe 2 antibiotics. We're looking at it differently. At Sanctuary, we're going to look at it from using a multitude of anti-Lyme therapies, because if you just kill off, say, the spirochete, but not the round body, or not the cyst, or not the different forms, those other forms will fill back in if you've killed off all the spirochete forms, the corkscrew. You have to kill all of them. So with that, we are going to use multi-therapies. Now, we may have to adapt that based on your allergies. Yes, we do antibiotics and natural therapies because they tend to work better and faster, more likely to get there. But we can do herbal therapies only, natural therapies only. We just let patients know that it may take a little bit longer to get to the end point of recovery. So we do the anti-Lyme therapies, but that's really actually the second or third thing we do. The other reason people have Lyme is their immune system is weaker. So it's not the other aspect of medicine that says, oh, it's just about the bug that's getting in you. Well, it's how your body's responding, which is why some people get it, some people don't, based on genetics and the response. If you have a strong immune system, you may fight it off and never have problems. But if you have mercury or mold or some other chronic infection or malnutrition from gut issues, your body may not be able to fight it off, and you need a little bit more support, meaning we're going to give you anti-inflammatory things, not just to help where you are now, but to prevent side effects like Herx reactions. We're also going to make sure your immune system has everything it needs. Your hormones need to be taken care of, vitamin levels. Make sure, again, toxins are not there that are weakening your immune system. So we're going to support that, which once we knock the bacteria down, we strengthen your immune system, so your immune system finishes the job. And then to answer one of the questions I'm often asked is the fact, do we probably ever 100% eradicate Lyme from our body? Probably not. I agree with the camp that says there's always some, maybe 1 to 10 bacteria in your body that's holed away, some little cyst somewhere, but your body's able to keep it down, keep its foot on the neck of the snake, and keep it away. Now, down the road, your immune system gets weak, chemotherapy, steroids, high stress. Yes, it could potentially come back, but we're going to try to help people not only get better, but stay better at the same time. So we do the anti-Lyme, support the immune system, support your body overall, and control the inflammation while your body's healing, because the other aspect, what takes you from wellness to illness, you have to remove that trigger, but to get back, it's not the same road. You actually have to go back to wellness by turning on restorative properties of your body, and we will help after we get rid of the Lyme to do that. So that's a walkthrough, a little bit of a whirlwind, but it does get you through what it is, why conventional medicine doesn't believe in it, how it can be diagnosed, with some confidence. It's not perfect, but and how we can treat it. And that's kind of the way we do on a regular basis at Sanctuary if you need help with that. So before I go into the question and answer part, just remind everybody that this is a question and answer session from here on out. If you have questions, do include them on the Facebook page, and I will try to get to as many as I can. And if you're interested in learning about whether or not you have... All right. Let me know if I'm back online here. Hopefully everybody can log in, but we had a little glitch, and then my computer I was using determined it was a good time to do an update on the Windows system. So hopefully everybody can get back on here, and we will pick up once I see a few that are on board. We will be picking up and answering some questions to finish out our time. So I think everybody let me know with a thumbs up that we are audio and video is coming through, and I will get back into the questions. All right, good. I've got at least one thumbs up, so let's go ahead. One of the questions from Angie: I've heard recently that it's possible for Lyme disease from a mother, or at least there are ways ticks to be more attracted to a person or whatever is passed from a mother who has Lyme. What do I say about that? That's her first question. So yes, I talked earlier about the fact that mom can pass to the fetus inside her or during birth because it can be in the bloodstream during that time. It is not as often as it happens with syphilis, because syphilis is in the bloodstream at higher levels. But there are many cases, and I do have a few that I'm pretty sure that's how my patient, who's a child, in those cases actually contracted the Lyme. Now, could it be that a tick bit the 3-month-old or the 6-month-old or the 1-year-old? Yes, but obviously it's a little bit less likely. The second question: can you be more attractive to the ticks once diagnosed? Do they smell you? So whether it changes after you have Lyme disease the first time, I am not sure. However, I do know that they are attracted to heat, smell, vibrations. So when there's movement, if they're hanging on a leaf, they do something called questing, where they'll hang on with some legs to a leaf until something comes by and bumps them. And they'll use the other legs to grab on. Or if they smell, I had some friends who worked in an office in Northeast Tennessee, where they say they would see ticks falling out of the trees when they were walking through, and they couldn't go on the trails certain times of the year because ticks would literally fall out of the trees into their hair or on their shoulders. So it's really a number of things that they sense, and they're looking for someone to bite. Now, it can be a regular animal like a deer, or it can be us. Another question: can you explain how Lyme disease can affect behavior and mental health? We all know that anxiety can be an effect of chronic symptoms or severe pain, but how does Lyme affect your mind? So yes, anytime someone has a chronic illness, where there's chronic suffering or chronic pain, it can make you more anxious to not bump that arm that hurts, or that joint that hurts, or to stand up on that hip that hurts. But yes, Lyme itself can cause symptoms beyond just what you would expect in terms of anxious about being sick. So one of the ways it can do that is directly causing inflammation in your brain. So like an infection, it can cause inflammation spots. On a rare occasion, you can actually see that on an MRI or a CT. It can also, as I mentioned earlier, make toxins, which then trigger more inflammation, like a chronic inflammatory response syndrome with things like C4A or TGF-beta1 or other immune system markers. It can cause that, which then may slow down your neurotransmitter production. It may dysregulate how you respond to neurotransmitters. It can also dysregulate your fight or flight, your autonomic system, causing more sympathetic response, which means faster heart rate, more adrenaline, which then makes you feel more anxious as your pulse goes up or you have palpitations. And you can get trapped in a hypervigilant phase, where your limbic system, part of the brain that controls that, is so over-revved that you just stay anxious. Even if you're tired, you may be wired and tired. inflammation of the brain can also trigger depression. So we are realizing that many forms of depression are actually inflammatory conditions that just have a direct effect on the brain. They can be metabolic, infectious, toxic, or other things. But with Lyme, again, the toxin or the infection triggering inflammation, triggering direct damage, can cause neurologic symptoms that lead to psychiatric or emotional symptoms as well. Another question from Lucia is family of five and 2 dogs had a toxic mold exposure 2013. Survived, and my mold doctor is in Maryland. 33-year-old daughter got bit by a tick in 2018. Test came back negative in 2018 for Lyme in February of 19, but started experiencing symptoms January, February, March of 2019. Found out June of 2019 that her doctor did treat Lyme as well, ordered a test that showed Rocky Mountain spotted fever and positive for CD57 panel. So then said she has chronic Lyme and started her on doxycycline, which is making her sick. Would the underlying mold make her more sensitive and in pain to things like EMF? Do you treat holistically, homeopathically, and have you had success? So this is kind of several things rolled up in once, but I'm very sorry to hear about your daughter. And the short answer is yes, if you've got mold toxicity, it can make other infections, including Lyme, come back to life. Yeast, Epstein-Barr, other chronic viral infections. It can make it easier to get other regular colds, infections like sinusitis, bladder infections. Your immune system is dysregulated. Instead of attacking outside things, invaders, it turns and attacks itself and leaves those invaders alone, so those things start growing out of control. So with that, looking at testing for Rocky Mountain spotted fever, and I'm assuming the CD57, saying that was positive, meaning it was low, means there's a higher chance that Lyme is active. So with that, we do treat a lot of those patients. One of the important things is looking for not just Lyme, but if a tick could have Rocky Mountain spotted fever, it could have babesiosis, Bartonella, Anaplasma, Ehrlichia, all these other things. And there's some either viral tick-borne illnesses that are coming to light now, like Powassan and others. But with those, you got to look across the board. Just because you do have Lyme, you make sure it doesn't have something else, or those symptoms could be Bartonella instead of Lyme, and you want to make sure you're treating the right thing, even though the treatment does overlap in some sense with the medications that are used. So yes, we treat. Sometimes we use doxycycline, but as I said earlier, we're always going to do a combination therapies from natural and pharmaceutical, and even pharmaceutical, usually more than one. Probably 70-80% of what we do is natural, but those pharmaceuticals do add a bit of effectiveness in hastening recovery. Although I will admit sometimes the HERT reactions are initially a little worse. So people, the first few weeks are a little harder, but they tend to get better and don't need as many cycles of the therapies, which we do cycles in 6 to 8 weeks at a time, rather than just, 2 weeks and you're done. But we're going to do those cycles until we see someone better, and both in terms of symptoms and labs. So I typically don't treat homeopathically. For those who don't know, that's using concentrations, very dilute substances. There are those I know that do use that, and they feel that they're successful. Where I found great success is, again, using things like the antibiotics and the right ones based on what tick-borne infection there is, combining with things like the curcumin, artemisinin, stevia, garlic, other products like that, which augment, either helping with biofilm disruption, which is a thin layer of mucus those chronic infections can live in, not just Lyme, but other things as well. And we're trying to come at it from all ways, kind of surround it and quell it, so again, your immune system can push it down. So we do see success. Sometimes it takes 4, 6, 8, 10 months, sometimes a year to see the full success that people are hoping for, but we do see it and help people get better. It's not easy, and it's kind of a slow process. We have to be, and patients have to be patient, but we can get people there. So those are the questions I have so far. Do we have any other questions, Stephen?
Not at the moment.
So if you have a few questions, now's a good time to put them in there. I'll give you a few minutes. I will try to, Well, while we're waiting on other questions, we'll take a moment and just talk about a couple of the groups that advocate for treatment. The IDSA, Infectious Disease Society of America, has a standard approach from specialists like infectious disease specialists, and then you have like ILADS, the International Lyme Associated Disease Society, who look at it from a more like I do in terms of using multiple therapies, being willing to recognize chronic Lyme and post-treatment Lyme when Lyme symptoms don't go away completely with what you would expect to be appropriate treatment, and that's often a matter of detoxing and repairing, not just attacking the Lyme ongoing and ongoing and ongoing. So the IDSA believes, oh, you just use the Western blot or the antibody test prior to that. You don't use any of these other advanced tests. You don't need to use anything else looking at how your body reacts. You only need to treat for acute Lyme for a specified time limit, even if it's a little bit longer for, again, joint problems, heart problems, brain infections, but it's a time limited, and then you stop. And they don't believe in the post-treatment Lyme and using the natural therapies either. ILADS, ILADS, is going to look at it differently and say, oh, we use clinical picture, we use other testing, and put those together to find who is likely to respond to those therapies, and then use therapies that are actually going to, over months instead of just a week or two, see people get better, whether it's neurologic, whether it's pain, whether it's mood, whatever symptoms it may be, and helping them get through that. So it's two very different approaches. Let's just throw another little nice one out there. Tick tubes. If you want to try to get rid of ticks on your property, we're going to try that this year. I can't say I've tested it yet, but I'm told that taking some permethrin, which is an insecticide, spraying on cotton balls, putting those in toilet paper rolls or plastic tubes, putting those out around trees and in bush shrubbery around your home or around your property. Mice will take those cotton balls to use to line their beds. Mice are where the ticks hide over the winter because the mice are underground and staying warmer instead of freezing. If there are permethrin insecticide on those cotton balls and the mice are rolling in it, they're going to kill off the ticks that are sitting on them and trying to live there over the winter. So we're going to see if we can knock down our tick population. Now, doesn't mean deer can't follow from somewhere else, but at least you're going to hopefully knock down the level. And we're going to try that, and maybe I can report in the spring how that goes. We did have a few ticks that we took off of us this year, very annoying little critters, but we're hoping to decrease that chance for us and our children coming around for the spring and summer of next year. So it seems like a quieter bunch today in terms of questions. Hopefully maybe that's the fact that I did a good job of answering all the questions ahead of time by introduction, but if not, this will still be up, and you can always leave some questions later, and I do try to follow up and look back and see if anything else pops up and answer those questions either by message or on this post at a later time. So with that, I'm going to close out, and with the fact that we will be October 10th, just in a few short weeks, talking about mold, pediatric mold, and mold symptoms or mold disease, mold toxicity in children. Again, 11:30 to 12:30 with Facebook Live. Thank you, and I look forward to seeing you then and helping you live a healthier, more abundant life.